Welcome back to Abled and Disabled. In this episode, we are talking to Ellen about her condition called gastroparesis.
Hello everyone. Are you bringing up the first question?
What is gastroparesis?
It is a condition of the gastrointestinal tract, which means that the tummy and often the bowel or the small bowel and the intestine can be paralysed. And with me, my gut is definitely paralysed.
Next question. Yeah. What causes it?
There's a few different causes. One is where they don't know what the cause is. Sometimes it can be from surgery. So if you have a abdominal surgery or any surgery where they can cut the vagus nerve, the main nerve that runs throughout the whole body, that will cause the gut to stop. Also, sometimes it can be caused from something like diabetes, or I've read it can be caused by, sometimes people with other chronic conditions can have it, or other syndromes, because if they have a problem with their cranial nerves, like I do anyway, it can be caused by that too.
What kind of surgeries have you had?
I've had most of my tummy removed. I've only got like a third left. I've had my gallbladder removed. I've had half of my bowel removed. I've had stomas to have my tubes. And I've also had lots of central lines when my tummy just did not work, because I had to be fed that way. And I've also had lots of tests and things where they put me to sleep. And I've had lots of different, I've had 3 hernia repairs. I've had a fundoplication, or maybe it was 2. I had 3 fundoplications where they try and tie something up, the fundo part, to stop the reflux. But because I've got the loose muscle fibres, it just always came undone. And now they say my hernia has come undone again, but it's not as bad as what it was a few years ago. But it's there, and they have to monitor it.
What treatment is there?
Mostly, often the treatment is not really much. Sometimes medicine helps it, to help the motility, to help things go down. Sometimes also you can have things like Movicol or things because you can get back up, like I do. And sometimes surgery does help. Some people might get a gastric stimulator or something, kind of like what you have in your tummy, but like a pacemaker. No, you know, like it's a pump like that, but it's not like that. But it will go in that same area, I think, if you know what I mean. And some people can get like massage or acupuncture to help settle things down. I'll get osteopath, which helps me. I've had acupuncture in the past.
Medication.
What? Medication?
Or is it pump with medication? That's what she's asking.
Yeah, it's medication like pain meds and normal meds and meds to help I don't think the pump was at medicine enough, but it has something to help to stimulate the nerves or something. I don't know what to call it.
So it will send tiny electrical shocks for the nerve, where Sev's pump is for medication.
Yeah, it's different, but I think it would be in a similar place, if you know what I mean. Yeah, because yours is kind of in your tummy, but it's not. Oh no, it's under the skin. Mine will be right in there, is that right?
Yes.
Yeah, if I get it, we're thinking about me getting one, but we're not sure yet because we'll talk to the surgical people when we see them. My tummy doctor sort of said, yeah, maybe, but she doesn't like me having surgery if possible it won't work. And I get, fair enough.
The next one is.
Do you have chronic pain, and if so, how do you manage it?
I've had chronic pain all my life, and sometimes I manage it by just trying to do things to take my mind off it. Sometimes I wind up in hospital for a few days gut rest, where I get nothing in my tummy except for except for just IV fluid to sort of help everything settle down. And sometimes I've had meds in the past, but that doesn't always work. And also my anxiety meds do help because that actually helps with the anxiety part. So that helps. And also I like to have, sometimes I relax or I read or I do things like that to help take my mind off of it.
Next question. So, do you want to say what you know? Is there any connection with gastroparesis and Charge syndrome?
I think there is research into because a lot of people with Charge are finding have a lot more gut problems. And a lot of people with Charge have problems with the cranial nerve. So there is a bit of a connection. It's just not maybe a connection that everyone knows about it, but it's in the research. So I think my doctor believes there is definitely a connection, but I don't know that everyone knows it. And there is someone who's researching it that's in Canada, and she has shown there are connections, which my doctor has looked up, and she believes that there probably is. But the problem is, because not everyone actually knows Charge or Gastroparesis, not everyone really makes that connection. So, and because there are many causes, they don't make that connection. But for me, I think they believe there is a definite connection between the vagus nerve and the Charge syndrome, but they don't know when that happened, if it happened when I was little, or if one of my surgeries might have helped make it work. And I think that's something they might never know. But I think my doctor believes there is a connection. She just doesn't know how or when.
Right. So it's just writing something.
The next one. What's the next one?
I actually didn't know that you had chronic pain until I got chronic pain.
Until you experience chronic pain.
Didn't we do that one about the pain?
Yeah, she's saying I actually didn't know that you had chronic pain until I got chronic pain.
Yeah. You didn't know that. I thought you did. I thought you would.
Yeah.
Maybe because I hide it well. Is that it?
Yes.
And then when you got it, I said, I have chronic pain. And you went, oh, you get it. Is that what happened? Yeah.
Next question.
Sometimes I think we have to hide it, because if we don't hide it, people might not want to be around it, because all we're doing is complaining about how full we are and how we want to rip the inside out. And there are people that might not like that.
Speaking of chronic pain, Seb's having a little chronic. I can give you more meds after this if you want. Is it here? Or is it further down? Oh, I didn't know if she wanted this.
How do you get fed?
How do I get fed? Is that what you said?
Yes.
I get fed from a feeding tube that I've had all my life. So part of it goes into my gut and just sits above the duodenum thing. And then the other part goes into the jejunum. When I was little, and actually when you first knew me, I had two. So I had the separate, and the J, it actually was a full-on, it looked a little bit like an ileostomy or a colonoscopy. And it had a piece of bowel or something that would stick out. Remember that bit? It looked like a little cherry or a strawberry or something. Yeah. And it was red, and it would just, you feed the tube through that little bit. But then when I was about 17 or 18, I started having problems with that. And now, well, maybe it was a bit later, and then we closed it because I was able to use the. But now they can actually do the J and make it look like the gastrostomy look like without having to do the big open stoma type surgery, which is better. But they don't want to do that to me because I'm okay with what I have. But if I ever needed it, they would do it. But they like me having access to both because I do need the vent sometimes to get the gas and the excess bile out, so it's good for me to have both. And they also don't want to give me too many operations either. Yeah, like you, is that right?
Yeah. Well, your doctor doesn't want to do too many laps close together because it can cause scar tissue, and that can become a problem.
Yeah. Is there another question?
Yes, that's just writing something. You have to get blood tests and stuff done soon. But you have to have like a diagnosis procedure happen after the test. Don't know when that will be.
Yeah. I'm having a diagnosis procedure to work out why, when I don't have a gallbladder, why I get pain there. My tummy doctor thinks it could be the bile duct or the liver, maybe, but she's hoping it's not that. But what she said is some people can get gallstones that come from the liver, so she thinks it's possible. But then she said, if that's the case, why didn't it show on the CT scan? And there's another answer. No one will know that until they go in and look.
No, we have one more question.
We're too complicated.
Do you think people understand what you have and why or why not?
I think some do, but sometimes when I get into the emergency, some of them don't. Because I think a lot of people just don't know about chronic conditions or chronic pain or my syndrome. But most people do get it, and all my friends do get it. But there are some people who think that the way I am with my anxiety or the way I obsess on people makes it worse. I don't think it does. I think I obsess on people more when my pain's getting worse, because I'm getting anxious anyway. Yeah, you agree? Yeah. You would agree, you know me, but 20-something million.
20-something million years.
Yeah. You know me, you know. But but what I find is in the emergency area, some of those doctors are really, really good, but then others will go, oh no, we need to check your, I think one time it was the spine, and we're going to do a CT for that, and we're all like, no, we know that it's just gastroparesis, we know that I just need gut rest. And apparently they said, oh, we've told the gastro registrar, they never came in. Then in the next morning I was at mid and I was put upstairs and I said that the registrar came up and she knew me really well and I said, oh, she said, I'm going to type down your fees. I went, no, they ordered a CT scan. I thought you'd want to do that first. She said, no, I cancelled that. I want to check your tube. I think it's your normal thing, and it was my normal thing. So basically it's the ones that know me get it, but sometimes the other ones don't. But I was lucky with the last one because the doctor was just taking me in a room and one of the registrars appeared because she'd been seeing someone and Mum had rang her up, so she knew I was going to be around. I think she was expecting it. And she's like, okay, put the drip in, take blood, put pointers up, and do a CT now. And the other doc went, oh, I didn't even have to get a history there. And then she did everything. And that was pretty good. Yeah. But I've had doctors say things like, well, why can't you just go on your pump through the G? If I could do that, then I wouldn't have come in and asked you to change the G, change the tube. And then the other one, the senior people will come in and go, yeah, we got it, and fix it. And the problem is my tummy doctor's one at the best, but she's on leave from the hospital. The other one that's replacing her is only there 1 day a week. And if she wants me to have tests, we have to go through the hospital. So she's got the upper GI person who knows me. And she basically last time said, if you go in, and they want to contact someone, tell them to contact him, not whichever one's on call at the time. Because that's the best way of doing it.
I get that. Got to check if it's something else. Oh, you are right, it's just endoflare.
Yeah.
What?
Well, going to the doctors and then not understanding that if it's something else and they have to do all these tests and then they realise that it's just an endoflare.
Yeah.
Like we've said.
Yeah.
But they're like, we have to check.
We all get those silly doctors, don't we?
We have to do...
I find there's a difference between a junior registrar or a resident and a senior registrar. And I find there is a difference between an ED doctor and a normal doctor up on the wards, because the difference is the ED people are learning. So the other doctor might say to them, oh, these are things you should check for in a normal person. But then what I think happens is the other doctors, those doctors that are telling them that, don't forget that we are not normal people. So then that's why we get all the silly tests. Whereas if we were able to just go in and, if I was able to just go in and see my gastro doctor right away or the registrar right away like the last time, it would probably go much quicker and I would probably wouldn't get stupid tests for no reason, because she's there going, well, I know what you need and let's do it. And she's telling them what she wants them to do instead of them ringing her up. She's already there telling them. And I wish we could have it like that all the time, but we can't.
They've also, like, for Sev, after her hysterectomy, the hospital that we usually go to didn't write it down that you've had a partial hysterectomy until recently, till like the last time we went. They're like, oh, it's not written down anywhere that you've had a hysterectomy. It's like, well, we told you guys every time we've come in since the hysterectomy. It's like, so you guys are doing like pregnancy tests for no reason. I'm gonna be real surprised if it comes up positive. I'll be like, it's a miracle.
And we're like, oh, no.
Like, no, she's had a hysterectomy. Why are you doing pregnancy tests?
And she's gay.
And so, and something I often find with them is sometimes when I'm in there, like they'll be good people, but sometimes like they'll order the wrong thing. So like sometimes you'll think they're ordering one, so like with the barium I had last time, I just, like the surgical doctor had said, oh, we're going to do a barium test and we'll do it down the, and I thought he said G, and I assumed he said the G, but then when I got down there they'd ordered the J, and I'm like, and then when we told my tummy, when we told the actual gastro doctor that, she's like, but then she said, at least we know, at least by doing it down the J, we know that the J's in the right place. And I'm like, yeah, but they done the CT scan that showed that. She said, yeah, but, and then she said, at least we also know that you're not, it's not coming straight up from the J, like you're not, and I'm like, yes, but then I did vomit it. She said, yeah, but where were you vomiting it from? It went straight down. I'm like, I don't know. It's like, I need to see the photo here. And I think she got them somehow because
One
I don't
time
know.
they got the wrong patient test and they said you are pregnant, and I said no, I am not, seriously not.
Yeah.
Was that after the hysterectomy? Or before? Yeah. They're like, your parents said no.
Yeah.
And then they're like, oh, we got the wrong test. It's like, you're supposed to double check. This is why we put names on tests.
They love double checking. And when so when they do it, it's like, well, I reckon most of, like my actual doctors that I've got get it. But the other problem is, and Mum is, like, and my eye doctor even said it, because Mum said to him, there is no general physician that will look at everything. And she was telling the eye doctor that he's known me since I was about maybe 3 weeks old or something. And he's like, yeah, look at us. We've got one that specialises in glaucoma, or one that specialises in the retina, or one that might specialise in or cataract or something else. And then he's like, and look at the cardio doctors or the other doctors. There's one that specialises in every little thing, but we do need more people that looks at everything. And that is one thing that I reckon we should maybe do a whole separate episode on one day. Like, or maybe not exactly, but you know, a chronic pain episode and who the best people are to treat those things or something.
Yeah. We need to ask Dr. David to come on too. But he's a busy man. So. Very busy man.
What are you typing?
It's great when Seb goes to have like a CT done or x-ray and the pump shows up and they go, do you know that's in there? It's like, yes, she's had a surgery for 12 hours to put it in there. Of course we know it's in there. If you look at her medical records, it actually says that she has a baclofen pump. How about you look at that?
Yeah, and they don't, like there's a big lump in your, I remember when I first met you, I used to wonder what that big lump was in your tummy. Because that's what it actually looked like to me. I know now it's a pump, but like someone looking at you would see that there's a big lump there, and they
Also,
should
I
work
think
that out that
we
it might
have
be
to
some
do
sort of
another
pump.
lab for sure.
We have another endo surgery. Well, we've already booked it
Also, I think I will have to do another lab for sure.
in. Yeah, that's in
Have to do a what?
another surgery for endo,
Yeah. Yeah.
which we've already booked in. It's in February.
Oh, that's pretty good. They can book me.
Yeah.
No, like so quick.
Because he's
Are you a category 1? That's what they do to make put me
He's,
category 1. Something
he's
like that.
private, so like he books
Yeah.
his own appointments, and then they correspond with the hospital,
Yeah.
and they sort it out that way. So like for any reason, if we have to cancel it, we have to go to him, and then they will report to the hospital. It's not as bad.
And now, I know, sometimes also with my gastroparesis, sometimes we look like my reflux, that's pretty chronic too. And sometimes when I've been in, I've had people, because I don't have a gag reflex, so I have people that tell me not to do it. And then I'm like, but I have to. And then once they say it all come out, they're like, oh yeah. What?
You have anything else to add, Bill?
Any?
I don't think we have any other questions. Do you have a question?
What's the last question? Or were we on the last question?
I think we were just talking. The film festival?
Oh yeah.
Yeah, the film festival. We got accepted. So we're going to like the award ceremony in August.
No, September.
September.
12th of September because
Something is happening in August, right?
12th of September because I have FAP time. And I already told your mum she's taking me.
Appointment.
And she's like, okay.
I know voting opens in August, doesn't it? Yes.
No, the actual thing that where we go, what's...
Yeah, but they open voting for the public in August.
Oh, yeah.
So it'll be on, what's it called? Like Focus on Ability Film Festival.
Yeah.
With Nova Appointment, right? Yeah. You can Google it up or I'll put it on the screen somewhere. It could be here, it could be there, it could be
Or you post it on
Thursdays.
Facebook. It's definitely on Facebook, I thought it there.
Yeah. But the audience doesn't have us on Facebook.
And you did it in the shorts that you got accepted.
And then you can vote soon.
Yeah.
Watch this space.
We'll do like an announcement video for that too. So when you can vote.
And we are going to everyone will be watching it. They'll be walking.
I have an idea for next year, but I'm not going to put that out on the internet because people steal things. So I'm not going to put that out in the universe because that's mine. It's copyrighted by my brain. Anything else to add? That's all. The puppies are chill for once, they're asleep.
The dogs are asleep for once. Well, Canoli is. Where's Noki gone?
Noki's in the bed. She's hidden. Yeah, you know it. We've talked about it before. No, they're okay. They're sleeping. They're sleeping. They're chill. Nothing else to add? No?
Except that I believe me and Red need a BRT top because we're always on the episode.
A little badge.
Or a BRT company. Are you trying to get the...
Thank you, Ellen. Next week should be the episode we are actually up to. I'm so sorry. I was sick last Monday and couldn't film. Like, comment, and subscribe. Stay pink and yellow.
Boy.
Ooh, there you go.